Mr. President, I rise this evening to oppose the confirmation of Representative Tom Price to be Secretary of HHS and urge my colleagues to vote no on his nomination. Representative Price might be the quintessence of President Trump's cabinet, a creature of Washington, deeply conflicted, and far out of the mainstream when it comes to his views on health care. Like other nominees, philosophically, he seems completely opposed to the very purpose of his department, the good governance of the health programs that cover tens of millions of Americans. Candidate Trump promised he would not cut Medicare or Medicaid, but Congressman Price has spent his entire career trying to cut Medicare and Medicaid and dismantle the Affordable Care Act. Mr. President, just listen to these quotes. The nominee for Secretary of Health and Human Services has said, quote, "Nothing has a greater negative effect on the delivery of health care than the federal government's intrusion into medicine through Medicare." That one might have come out of the 1890s if we had had Medicare then. He said he expects lawmakers to push forward with an overhaul of Medicare, quote, "within the first 6 to 8 months, unquote, of this new administration." Does that sound like someone who doesn't want to cut Medicare and Medicaid? It doesn't to me. It doesn't to the American people. In fact, if you could pick someone who in either house of Congress was most likely to cut Medicare and Medicaid, you'd pick Congressman Price. It could not be more of a contradiction to what candidate Trump promised in the campaign. So, Mr. President, here's what worries me. From what I know of the president, he will cede great authority to cabinet officials, content to jump from one topic to the next, one tweet to the next. I would put much greater stock in Rep. Price's record than anything the president has promised during the campaign, and that is very bad news for seniors and the American people in general. And for that reason, every American who receives benefits from those programs, the millions of American seniors, women, families, and people with disabilities, should be gravely concerned about what the tenure of a Secretary Tom Price will mean for their health. Mr. President, make no mistake, in the dark hours of the early morning, with the confirmation of Secretary Price, the Republicans launch the first assault in their war on seniors. The war on seniors begins when we select Secretary Price over our votes as Secretary of Health and Human Services. When it comes to the health care of older Americans, confirming Rep. Price to be Secretary of HHS is akin to asking the fox to guard the hen house. It's been revealed that in his time in the House, Rep. Price engaged in a number of questionable practices related to the trading of stocks in issues that his legislation impacted. And there are many instances. To save time, I won't go through them, but just ask they be placed in the record. And the allegation— Thank you, Mr. President. These allegations alone might be enough to sink a nominee in another administration. But it seems this cabinet is so rife with ethics challenges and conflicts of interest that Rep. Price's conduct in the House doesn't place him too far outside this unethical norm. But, Mr. President, that should be no excuse. When you're a congressman or a senator, you must endeavor to avoid even the hint of a conflict of interest, let alone a situation where you're actively trading stocks that may be impacted. So, Mr. President, this is a sad evening. The war on seniors by the Trump administration begins when we confirm Representative Price. People will look back and say that the Republican war on seniors began at 2 a.m. on Friday morning when the Senate, unfortunately, confirmed Rep. Price. I urge my colleagues to vote no. I yield the floor and once again thank my colleague.
Thank you, Mr. Leader.